Happy Thursday, everyone. It is noon and you're watching CBC News BC. I'm Jessica Chung here in the CBC Vancouver newsroom. Okay, let's get to your top stories. Now, here's some news for you beachgoers. Now, you'll be allowed once again to enjoy an alcoholic beverage at several beaches in Vancouver this summer. Starting on Saturday, people of legal drinking age are allowed to bring and consume alcohol between 11 a.m. and 9 p.m. But just a couple of notes there. Glass bottles and containers are not allowed, and only certain beaches are included in the program.
There's various beaches and parks in the city where you cannot be consuming open alcohol. If that is the case and our officers are on the beaches and we do see people drinking open alcohol, those people can expect to have a conversation with us. We have many tools that we can use to stop any disruptive behavior, and it ranges. It can be from having a conversation, issuing a ticket, and if there's unruly, aggressive behavior, that could be a time in jail as well.
Now, drinking will not be permitted at English Bay Beach, Sunset Beach, Third Beach, Crab Park Beach, and any beaches along the Fraser River. And the program will run until the end of September. And BC's Provincial Health Officer Dr. Bonnie Henry testified before the House of Commons this morning about the opioid epidemic and the toxic drug crisis in the country. Now, the federal government is looking for strategies to better deal with it. And Henry says record numbers of people are dying now because of the potency of drugs has never been higher. And she's worried at how the issue is becoming politically polarized.
I think it's very important to recognize that harm reduction and recovery and treatment are not in competition. It is not either or. They are both essential and necessary parts of a continuum from prevention, from understanding what's on the street, to harm reduction, to treatment, to recovery.
She also says it's a mistake to think of recovery as abstinence and that it should be thought of as a process through which people improve. The Health Committee is scheduled to hear from a variety of experts and stakeholders in the coming days. And Premier David Eby is responding to allegations over his office's involvement in controversy over a possible safe consumption site at Richmond General Hospital. Now, back in February, Richmond councillors passed a motion asking Vancouver Coastal Health to explore the idea, and that was met with vigorous protests for and against at City Hall. And then 2 weeks later, Richmond shelved the motion, and this after Vancouver Coastal Health said it had no plans for the idea. Now, some media say they have uncovered communications between the Premier's office and VCH over the matter.
There was a huge amount of misinformation in the community about what the intentions were of Vancouver Coastal Health. People were profoundly divided. There were really hateful things being said, and Vancouver Coastal Health had decided that they were not going ahead with that there was not a need for a safe injection site at the hospital, a safe consumption site at the hospital, and they hadn't communicated that to the public. So we encouraged them to share their decision with the public.
And VCH said at the time that standalone harm reduction sites work best in communities where there is a significant concentration of people at risk. And that's it for us. I am Jessica Chung. You are watching CBC News BC. Of course, stay with us for all of that continuous news. We're going to give you updates now and until into the afternoon. But first off, BC Today is up with Michelle Elliott next. She is right behind me, right over there. Stay tuned.
Good afternoon. Thank you for joining us. New guidelines for breast screening say routine screenings should be kept to women in their 50s and older. But some experts argue regular screening must start at 40. Is early screening important to you? What do you think of the stated risks of over-testing and anxiety? How important is early screening, rather? In half an hour, how do you feel about big corporate names on public spaces? That debate is raging. We're going to dig into it. I'm Michelle Elliott. Welcome to BC Today. Thank you for joining us. We are live on CBC Radio 1, as well as CBC Television, and live streaming too on CBC Vancouver's YouTube page. You can also go to CBC News BC. Just use our CBC News app, and you can click on the video tab. You can call us now on our top story. Today, a national task force issued the latest guidelines on breast cancer screening. It says people should be able to get a mammogram starting at age 40, but it shouldn't be routinely offered to women under 50 who are of average risk. We're asking if you agree with those guidelines and how important to you is breast cancer screening in your 40s. Does information about breast cancer screening need to be improved? Our numbers are 1-800-825-5950, 604-669-3733, and you can hit pound 690 on your cell phone. You can also email us bctoday@cbc.ca. We'll take your calls on that in just a moment. And coming up in our next half hour, after 12:30, we will get into that whole debate that's been raging this week over public spaces and corporate naming. So the City of Vancouver says it is considering selling naming rights to public parks and other city-owned assets. This is in order to generate revenue. And that is just one of the recommendations the city is considering to tackle a gap in infrastructure funding. And we're asking for your thoughts on it. What are your thoughts on corporate names on public spaces? Does it make you cringe, or is it just realistic? Our numbers again, 1-800-825-5950, 604-669-3733. And you can hit pound 690 on your cell phone. We will take your calls on that coming up after the 12:30 news update. The Canadian Task Force on Preventive Healthcare issued the latest guidelines today on breast cancer screening. Now, while some experts in Canada have been calling to lower the age of regular screening mammography from 50 to 40, today's guidelines kept the age recommendations the same at 50. It says people should be able to get a mammogram starting at 40, but it shouldn't be routinely offered to women under 50 who are of average risk. Now, the task force noted routine screening carried potential harms. And here's what one advisor to the task force had to say about those possible harms. Dr. Michelle Nadler is a breast medical oncologist at Princess Margaret Cancer Centre in Toronto.
Some of the potential harms, and again, we don't know who these will happen to, are additional tests, such as additional mammograms, ultrasounds, that are needed to be done to show no disease. This was previously called false positive. Additional biopsies needed to show no disease. And for some, people may be fine with that, and other people may not want this to happen.
Now, the task force emphasized its draft recommendations are for women at average risk or at moderately increased risk. They do not apply to those with a personal or extensive family history of breast cancer, genetic mutations that would increase breast cancer risk, or symptoms suggestive of breast cancer. The guidelines today, though, are getting backlash. The Ontario Association of Radiologists says that the update is not evidence-based. It's even calling for the task force to be disbanded. We're going to hear from a medical expert on this right now, and we are asking you, do you agree with the age recommendations for routine mammograms to start at 50? And how important is screening to you at age 40? And does information around that breast cancer screening and age need to be improved? You can call us now, 1-800-825-5950, 604-669-3733, and you can hit pound 690 on your cell phone. You can also email bctoday@cbc.ca. And for more on this, I'm joined by Dr. Paula Gordon. She's an expert on breast screening, clinical professor in the Department of Radiology at UBC. And she also gave testimony about the need to change the breast screening guidelines to the Parliamentary Committee on Health. Dr. Gordon, good afternoon. Welcome back to the show.
Hi, Michelle. Thanks for covering this important topic.
You have long called for routine screening to start at age 40. So what do you think of the reasons given today to keep it at 50?
Well, the task force has disappointingly not kept up with the current data. In fact, they ignored large swaths of really good data coming from Statistics Canada and from especially the University of Ottawa that shows that women who live in provinces that don't screen until age 50 are more likely to be diagnosed with an advanced breast cancer and have poorer survival. Women may not realize that 17% of breast cancers occur to women in the 40s, and they have more years of life to lose. Furthermore, when we find cancer early with screening, women have more options for treatment, which the task force didn't consider. For example, when we find a breast cancer early, women can have a lumpectomy instead of a mastectomy. If we find it early, women can avoid the big armpit surgery that can be associated with lifelong hand and arm swelling. And especially when we find a breast cancer early, women can sometimes have the option to avoid chemotherapy. But instead, the task force overstated the risk of a false alarm. Now, many women will accept false alarms rather than be denied the opportunity for early diagnosis. We're used to that with pap smears, for example. And of all the women who are recalled for additional studies when their screening mammogram is inconclusive, only 5% of them end up being diagnosed with breast cancer. Women need to know that. Don't panic if you get called back. But to use that as a reason to not offer women screening or to talk them out of getting screened, believe me, women are a lot more anxious when they're diagnosed with an advanced cancer that may have already spread to other parts of the body.
And you touched on this a little bit. The screening practices are different in each province, irrespective of what the guidelines say. So what happens in BC?
Well, British Columbia was the first province to offer a screening mammography program in 1988. And from the get-go, women in our province luckily have been able to self-refer to have a screening mammogram starting at age 40. The unfortunate thing is that many family doctors have been misled into believing that this task force is composed of experts. And so they trust and follow their guidelines. And so only 25% of eligible women age 40 to 49 are currently having mammograms in British Columbia. We hope to get that number up.
What was that percentage again? Pardon me?
Only 25% of women in the 40s in BC are having screening mammograms.
Despite
and
it being
women
available.
sometimes think, yes, and some women think, well, I don't have to worry about getting screened because no one in my family's had breast cancer. I hear that a lot. Women and sometimes doctors are surprised to learn that 85% of women who get breast cancer have no family history. So all women should be offered the ability to be screened. Now, the task force isn't forcing anybody to be screened. We need to educate women and their family doctors as to the importance of screening. But definitely, women in British Columbia don't need a requisition. In other provinces, they're not so lucky. So that's why we have to get the task force to look at the modern evidence that they ignored.
Let's take some calls now. My guest is Dr. Paula Gordon, who's a professor at UBC in the Department of Radiology, an expert on breast screening. And we're taking your calls. What do you make of the guidelines out today that maintain the recommendation that routine screening for breast cancer, routine screening mammograms be available for people 50 and up? And that for women who are 40 and up, that they be available but not routine. What do you make of that? Do you agree? Or how important is early screening to you? And let us know if you think the messaging around breast screening needs to be improved. Our numbers again are—
And Michelle, can I just—
Sure.
Sorry, can I just jump in with something else while you're waiting for your first caller? The task force made several recommendations. The recommendation to not screen women routinely until age 50 is one of them. But they also said that women should not be routinely screened after 74. They got that wrong. They also said that women who have dense breasts don't need supplemental screening with ultrasound or MRI. They got that wrong. So this is just what we're talking about today is only one of their guidelines. It's an important one, though.
Okay. And so when you say that this is a task force not made up of experts, on their website, they do say it's an independent body of 15 primary care and prevention experts. There are family physicians, pediatricians, physician specialists. We heard from an oncologist there who's an advisor. So is there consensus on this among medical experts?
Well, so you just said they're family doctors, nurse practitioners, statisticians. You mentioned a pediatrician. In the past, they've used an occupational therapist and even a chiropractor to make the breast cancer screening guidelines. There were no breast cancer experts, no radiologist, no oncologist, no surgeon, no pathologist on the panel that made the guidelines. They say they consulted experts, but I know from the people who were invited to give input that the advice was largely ignored. And you're always going to find people like Dr. Nadler who don't necessarily have all the most recent data at hand.
So when they're making these guidelines, though, why do you think they didn't listen to your perspective versus, someone else?
So the main reason is what they consider credible evidence. And there are lots of different ways of doing research. The kind of trials the task force almost limited their review to are called randomized controlled trials. That's where you have a study group and a control group. One of them gets the test, one doesn't. You wait a couple of decades and count the number of people who have died. The problem is that the randomized trials on which the task force leaned so heavily were done 40 to 60 years ago. And there won't be any new trials because those old trials proved that mammograms save lives. So it would be unethical to do a new randomized trial nowadays when a group of women is not screened at all. And the task force did look at some more recent data. For example, there was a large study. In fact, the largest study in the whole medical literature was done in Canada. And it was published in 2014. And it showed that women who get screened starting at age 40 are 40% less likely to die of breast cancer than women who don't. Now, it wasn't a randomized trial. It was an observational study. And even though the task force say they considered it, they weighted it much lower than those 40 to 60-year-old trials. Okay. So that was one way they minimized the benefits of screening by only relying on those randomized trials. And second of all, they exaggerated the risks.
Let's take some calls now. Jennifer is on the line in Vancouver. Hi, Jennifer. What are your thoughts on these guidelines today?
Hi, thank you for taking my call. I just wanted to call in as a woman who was diagnosed with breast cancer at the age of 41 to say that, speaking on my behalf, and I think on behalf of a lot of women, this is extremely disappointing. I was thrown into the world of breast cancer in 2020 as COVID was hitting and learned a lot. And everything I've learned is that, as was stated, that 85%, it's a large percentage of women have no family history. I had no family history. I would not have been considered at risk for getting breast cancer. I would not, in a lot of places, I would not have qualified for screenings, yet I was diagnosed with breast cancer. I'm seeing more and more of friends and colleagues my age being diagnosed with breast cancer in their 40s. And everything I've learned going through the process is that yes, we should be getting regular screening more often. Dense breasts are an issue. That was something that came up, and you need additional screening for that for younger women. So I cannot wrap my head around this. I feel like women already have to advocate on their own behalf so much with doctors, oftentimes, to be taken seriously. And I thought we were making progress on that. I think this will bring us several steps back. It's just going to make women have to fight even harder to be taken seriously by their doctors.
Jennifer, great to hear from you. Thanks so much.
Thank you.
Great comment. And Jennifer's right. The hard part now, of course, is that there's a huge shortage of family doctors. And women who have a doctor that pushes back on screening are afraid to advocate for themselves and disagree with their doctor because they don't want to get fired as a patient.
And I have to say, I was surprised when I heard you say this morning that you don't need a doctor referral to go and get screened.
No, you do need to give the name of a You do need to give the name of a family doctor or a nurse practitioner to receive the results. That's a problem. Women can't get screened. Even a woman whose mother died of breast cancer can't have a screening mammogram in British Columbia if she can't give the name of a primary care provider. And we're the only province that does that. So there needs to be a workaround for that. Yes.
Okay. Brenda is up next in Vancouver. Hi, Brenda.
Hello. I don't quite fit the profile because both my breast cancers were found with a small lump. But the fact is, I had breast cancer when I was 39 and then again when I was 49 and successfully treated with mastectomy and chemotherapy. And I'm fine. I'm almost 80. So it's a real testament to early diagnosis and treatment. And thank you, Dr. Gordon, for all you've done to try and get this fixed.
Good to hear about your outcome, Brenda. Thank you very much for the call. Melina is next in Vancouver as well on the latest guidelines on breast cancer screening to offer it routinely at 50 and up. Hi, Melina.
Hi there. Can you hear me? I have a few comments. I agree with everything that people have said so far. I wanted to mention that these are draft guidelines, so everyone who has spoken and who is listening can actually, on the website of the task force, give feedback about why they agree or not. I have concerns about, how other jurisdictions are shifting the screening guidelines to the and above, and yet we seem to be going backwards. That's one of my big concerns. And the other, which doesn't seem to get any, the doctor just mentioned it a little bit now, but the point that they're not going to stop people from, over between 40 and 49, but they're also not going to recommend. The big, for me, elephant in the room is, so who's going to do that? So we know that, as was mentioned, there's a shortage of family doctors. So right away, there are people without a family doctor who get excluded. There are people who don't have the knowledge, the time, the energy to self-advocate. Who's going to know that that they can ask if they can even get to a doctor? So we're talking about language minorities. We're talking about people who don't go to the doctor for all kinds of reasons. So there is an equity issue in terms of the people who may know about pushing the system to get something versus the people who don't know or are going to have a lot of troubles accessing something that could save their lives. And this is not talked about anywhere. So the difference between a guideline which lands very differently than, and the message I don't think gets to pretty much anyone except for people who are seeking out this kind of information, that you could get it if you ask for it, is a serious equity issue and needs to be highlighted.
Melina, thank you very much. That's an important point about equity and, who has the ability to self-advocate and what that does in terms of access. I know that Dr. Gordon has to go fairly soon. I want to get to Heather in Langley in order to respond to a question here. And then perhaps you can respond to what Melina had to say, Dr. Gordon. Hi, Heather. Go ahead.
Yeah, hi. I was asking about the procedure itself of compressing the pressure on the breast. If there is some sort of mass or boil in your breast, would that spread if it was pressed enough to burst?
Okay, Heather, thank you very much. Dr. Gordon?
So let's answer Heather first. No, the compression is not dangerous. It doesn't cause anything to spread, including cancer. And in fact, women with breast implants should also be having mammograms, although they can't go through the screening program. They need to have a diagnostic study. But getting back to Melina, first of all, to make it very clear that in British Columbia, women can self-refer. They don't need their permission or a requisition or anything else from their family doctor. But she raised a really good point that the task force ignored, and that is that we know that racialized women, especially Black, Asian, Hispanic, and Ashkenazi Jewish women, are at higher risk to get breast cancer, and racialized women get breast cancer younger than white women. In fact, it peaks in the mid-40s for Black, Asian, and Hispanic women. So those women definitely should be having mammograms younger, starting at 40. Actually, all women should, but especially the people we know who are more likely to get breast cancer younger. So I'm glad Melina brought that up. The task force was made aware of that, and they did not incorporate that into their guidelines at all.
Now, you touched on this earlier. You said you don't need a requisition to access screening, a mammogram, but you do need the name of a family doctor to get your results. So how do you work around that?
Yes.
I have an email here from JC who writes, how do you get a mammogram that's recommended at 40 years of age due to at-risk family history with no family doctor? A patient was refused service after attending their appointment due to not having a family doctor. So how do you work around that?
Well, we don't have to reinvent the wheel. As I told you, we are the only province or territory that has that requirement. We can certainly speak to our neighbors and find out what they do, but I am very aware of a new program in the Ottawa region where people who need referrals for screening can attach themselves to this screening referral clinic that will make referrals for various kinds of screening, including breast and cervix and colon and prostate and so on. So there are workarounds. We just have to make them happen in British Columbia. There's too many women who are being prevented from getting screened for that reason.
Dr. Gordon, as we wrap up here, what is your advice then for our listeners, women in their 40s or above 70, as you said, for whom these the routine screening is not recommended?
Definitely in British Columbia, we're lucky because, first of all, women here can self-refer in the 40s. And in fact, in British Columbia, we're one of, I think it's 6 provinces that allow women to continue self-referring, excuse me, until age 80. So definitely do that. Also, do breast self-examination. Get to know what your normal breast texture is, because not every cancer is visible on a mammogram, and sometimes women can find it themselves. When you have your screening mammogram, read the report and find out what your breast density is. You'll be told whether you're in category A, B, C, or D. Categories C and D are dense. Women with dense breasts are at higher risk to get breast cancer, and they're at risk that their cancers might not be seen on their mammogram. So try to advocate to have supplemental, that means additional, screening with ultrasound, or if you're very high risk, with MRI. And then keep referring yourself up until age 80 if you're in excellent general health and you're not at risk of dying of something else imminently.
Dr. Gordon, thanks very much for your time. I know it's a busy day for you.
Thanks, Michelle.
Dr. Paula Gordon is a clinical professor in the Department of Radiology at UBC. Now, the federal health minister has just issued a statement on the draft breast cancer screening guidelines, and Mark Holland has issued this statement on X. I'd like to thank the work of the Canadian Task Force on Preventive Healthcare for the updated draft breast cancer screening guidelines. The task force is an independent panel created to design national preventive healthcare guidelines. However, while this process has been independent, I have serious concerns about the task force's findings. It is critical that these guidelines provide the best guidance to both Canadians and our healthcare system. Therefore, I am taking the following steps. First, I'm inviting leading experts on breast cancer to carefully review the draft guidelines and to share their critical analysis. Secondly, I've asked the Chief Public Health Officer to convene the senior provincial and territorial officials and key experts to review the guidelines. And lastly, I'm just reading portions of this statement. Minister Mark Holland also says, I've asked the Public Health Agency of Canada to accelerate the launch of external expert review that will examine the processes of the Canadian Task Force on Preventative Healthcare and provide recommendations. It's important that Canadians trust the process of public health guidance. So that's part of a statement just issued in the last hour by Mark Holland, who's the Federal Minister of Health. Thanks so much for all of your calls on this as well. If you want to email us, bctoday@cbc.ca. And it is 12:30 now, Pacific time. Coming up in our next half hour, we're going to take your calls on something that's really created a lot of chatter online and around Vancouver, and this is to do with corporate naming of public spaces. And this is something that's being mulled by the City of Vancouver in order to generate revenue, thinking about selling naming rights to public city-owned assets. We'll take your calls. What do you think of that? Is it something that you see as crash? Does it make you cringe? Or is it just a reality? You can give us a call on that coming up. And right now, though, is a CBC News update with Rob Zimmerman.
Good afternoon. An RCMP officer at the Bella Villa detachment is being transferred after allegations he made racist posts regarding Indigenous people. The Healtsick Nation protested last week to get the officer out of the community. The Mounties say they moved fast to address Healtsick concerns, and the officer's status in the force is being continually assessed. Dr. Bonnie Henry testified today as the House of Commons Health Committee looks for better strategies to deal with the current drug crisis. Henry says record numbers of people are dying now because the potency of drugs has never been higher. She's worried at how the issue is becoming politically polarized. And Vancouver City Council has approved a pilot project looking at creating pod hotels. The pods would be a more affordable micro-suite option for tourists. The motion suggests looking at older office buildings and heritage buildings that could be converted. And now the forecast on the north coast, showers tapering off this afternoon, then cloudy with a high of 10, highs to 17 with a mix of sun and cloud in the Peace. In the central interior, including Prince George, some sun and cloud with a high of 15 degrees, highs to 16 with some sunny breaks in the Kootenays. In the southern interior, including Kelowna, a mix of sun and cloud with a high of 17. And for Metro Vancouver, Greater Victoria, and the Fraser Valley, lots of sunshine this afternoon with highs around 16. That's your CBC News update from Vancouver.
So will those pod hotels be called Apple iPod hotels? If we're going down the road of corporate naming?
Yes, good call. Sure.
You're welcome.
Yeah, nice. Apple iPod. Nobody uses an iPod anymore.
That's
Michelle.
true. Yeah.
You're dating yourself.
I am. I remember back in the day,
I had
we
to think
would walk
about
10
iPod.
miles in the snow listening to our iPods.
That's right.
Yeah.
My day, it was Walkman, all right?
Yeah, exactly. Yeah. 8-track, more like. No.
Ouch.
Ouch.
Yeah.
No,
that's true.
Walkman.
No.
I was excited when the CDs came out, okay? I was like, look at this.
The disc players?
I was, look at this newfangled thing.
Yeah.
Yeah, they're flat, they're silver, they're shiny.
It was like an updated 8-track, really. Right?
Yeah. We are dating ourselves so badly right now. Oh, Rob, okay, you go. Listen, I guess you have, I do only have like an Apple, an iPhone 6, 10?
An iPhone 6?
It's
Wow.
an old one. It's an older one, that's for sure.
Yeah,
So
I'm not even sure what mine is, but it's up there.
Oh, wow, good for you.
Yeah.
Well, thanks, Rob. You're fancy.
Mm-hmm.
Fancy Rob.
Sure.
Fancy Rob Zimmerman in the CBC Vancouver newsroom. Welcome back. You're with BC Today here on CBC. Thanks so much for joining us. And tomorrow we are hoping to talk about crows as well. You may have had your own crow encounters these days, whether you're in the city of Vancouver or another part of the province. We'd love to hear your stories about your crow encounters. What do you think of them? They are a beautiful creature, very smart too, but certainly not a favorite for a lot of people. We'll take your calls on that coming up tomorrow. All right. Well, imagine if Stanley Park suddenly was called something like Labatt's Park or Wells Fargo Nature Area. Does that make you cringe? All right. Those are just possibilities, but that is something Vancouver already has done with other public spaces like arenas named for companies like Rogers Arena, TELUS World of Science. So we're familiar with those. A new amphitheater at the PNE also will be named for a corporate sponsorship as well, Freedom Mobile. But the topic of big company logos on our public spaces, whether it is crash commercialism or just economic reality, it is becoming a heated debate this week. That's because Vancouver Mayor Ken Sim has said staff are looking into that as a source of revenue. The City of Vancouver is considering selling naming rights to public parks and other city-owned assets to generate money. He says it is just one of a number of suggestions, though, and he says talks with interested parties could happen this fall. Now, it is one of the recommendations to tackle this gap in infrastructure funding and property taxes. So we're asking, what do you think? How do you feel when you see a corporate name on a public space? You can call us 1-800-825-5950, 604-669-3733. You can hit pound 690 on your cell phone. And if you'd like to email us, bctoday@cbc.ca. Well, Vancouver City Councillor Brian Montague spoke with Amy Bell on the Coast, and he said that the city will choose naming partners carefully.
We have to be very clear that we're not going to just sell naming rights to anybody that wants to shell out some money. There's going to be a very thoughtful process and some due diligence on the companies themselves, and we're going to make sure that it's a good fit for Vancouver.
So we're not going to see Labatt Stanley Park at this point.
Like I said, we want to make sure that anyone that comes forward with money in hand is a good fit for Vancouver, that isn't controversial, fits in with our values and what Vancouverites want to see.
That's Vancouver City Councillor Brian Montague. Well, the Early Edition spoke with Vancouver's former chief planner, Brent Todderan, about this, and he says sponsorship isn't unusual. Places like the Vancouver Art Gallery have done it, but it ought to be done thoughtfully.
Well, you look at a lot of parks, civic space, civic things, even the VAG and their naming rights, the Chan Center now. You can have a place within an area that acknowledges a donor.
Sure.
In parks for decades and decades, there's been this place where all the contributors named, and that's actually good placemaking. It's good storytelling, good historical record keeping about who contributed. But it almost never affects the name of the thing. The name of the thing is where the real touch point is here. Because this sponsorship is normal, contributions are normal, community-based ones are the best because they actually support and facilitate community-based placemaking. Yeah. But that's relatively normal. The thing that has changed is the crypto.com arena, the idea that you can buy the name with a superficial involvement in the city building.
All right, we are asking for your thoughts. Have you been talking about this with your neighbors online? Have you been posting on social media about it? We know that it's something that's generated a lot of reactions. So what are your thoughts? How do you feel when you see corporate names on public spaces? And what do you think of Vancouver considering more of this in order to generate revenue? You can call us 1-800-825-5950, 604-669-3733, and you can hit pound 690 on your cell phone. By email, bctoday@cbc.ca. And joining me now to talk more about this is CBC's Municipal Affairs reporter, Chad Pawson.
Hey, Michelle.
Hey, Chad. What do you think of this story? How do you feel when you see, when we walk by Rogers Arena every day?
Yeah, I think that one stuck for me.
Yeah.
So, when we're going to go to a concert there, a hockey game, we do say Rogers Arena. So you can see how they become part of the lexicon. But others have not stuck for me. So the marathon in town has a sponsor. I believe it's the BMO Marathon, but I just say it's the Vancouver Marathon.
Is that right? Yeah.
And there's others that just, they don't stick. You heard our colleague Stephen Quinn talking about Nate Bailey Stadium. It's just the Nat for him, so it doesn't have the sponsorship in front of it, which it now does.
Yeah, like I still call it Science World. I do not call it the longer TELUS World of Science.
Yeah, so that's what goes through my mind is that, they can stick, they can be part of city building, as we heard Brent Todderan talking about, but sometimes they just never stick.
I have to say too, I notice it more when I'm traveling in a different city because then, you're not as familiar and things don't just roll off your tongue as much as a Rogers Arena or whatnot. But yeah, I notice it if I'm, I was just in San Francisco and I noticed when certain things were called, like a lot of their basketball arenas are called companies and you just go, whoa.
yeah, good point. Yeah, indeed.
And so why is the city actually considering this? Take us through that.
Yeah, let's go back. I think this is a product of Ken Sim being elected as mayor in 2022 with his ABC party. And he struck this mayor's task force that looked at all the finances. And a lot of that task force, what was tasked to do was to look at how can we generate financing in the city that doesn't involve tax increases. So, Ken Sim said, we can go anywhere with this. It could be anything. And so this is part of that we could monetize parts of the city buildings, city infrastructure. We have all these properties, we have all these holdings, we have all these things. Is there a way that we can partner with the private sector to gain money? So, at first blush, it's not a bad idea at all. The city owns lots of things. It has lots of things, parks, pools, just even spaces, sidewalks, all kinds of things that could be partnered with a private sector. But then we get into this problem that is it tasteful? And I think we've heard so far reaction to this that the first response to this is often distasteful, that we're willing to sell these city assets or allow the naming of these city assets with corporations, and there's a sort of distaste to it. But let's think about what it actually does, and it provides funding that wouldn't be coming from taxpayers. So where is the happy middle ground here, as you heard Councillor Montague talking about? Is this unusual? No, we've heard all kinds of examples. There's examples here that stuck, like Rogers Arena. This is something that's been done for many years, for decades even, but I think a lot of times they're associated with big things like arenas.
Right, yeah. And with GM Place before that, too.
Yeah.
Let's take some calls now. We are asking you, what are your thoughts when you see corporate names on public spaces? What do you think of what Vancouver is considering? Not unusual, as we've just heard. Give us a call, 1-800-825-5950, 604-669-3733. You can hit pound 690 on your cell phone, or email bctoday@cbc.ca. My guest is my good friend Chad Pawson, CBC's Municipal Affairs reporter, doing a great job filling in for Justin while he's off visiting various 52
seeing corporate branding around the world.
I know. I was going to say, are we going to see more photos from him of corporate branding? Trajan is calling us from Castlegar. Hi, Trajan.
Hi, how you doing?
Very well. What have you noticed?
I've actually got a couple things. The first thing is this sure smells a lot like the Adopt a Road campaign or Adopt a Highway campaign that we went through to try and keep the sides of the highway clean.
Yeah.
And that never happened. You know, you see a sign that says, I adopted this road, but they don't ever bother to clean it. And secondly, I travel a lot for work, and I spent a lot of time in some small communities across Western Canada, working in sawmills specifically. And a lot of sawmills would invest in infrastructure. They would spend a lot of money to build a community center, a pool, an arena, something that the community needed. And then they would have the honor of putting their name on that facility, whereas instead of just paying for it once and, you know, then they've got the right to have that name on the facility for a long-standing period of time.
So it's not ongoing would be the difference with something like an arena.
It could be ongoing. I am not sure how the pay structure would work, but I mean, like, they're not really giving back a lot to the community other than tax dollars, right? So it doesn't really trickle down to all members of the community. It just trickles down to how that community sees to spend it.
And in those instances, do you find that more palatable, Trajan, then?
Yeah, I think, you know, providing back for a big thing in a community. Like, I've been to some very small towns, 600-700 people, where the sawmill footed the bill for a whole community complex, a pool, a gym, an arena, something that the community really needed but couldn't afford.
Yeah. That's so interesting. Great to hear about your travels. Thanks so much.
Awesome. Thanks for taking the time.
Yeah, that's Trajan in Castlegar. So more of that. Is this company actually investing in the community?
Yeah, and I think Trajan raises a good point. Like, what are the terms of these deals? As we know, they can be fleeting. Our bike share program here, of course, was one company with a color scheme, and then now it's a new company, Rogers, with a new color scheme, and it changes. So is the city going to be able to establish some of these deals that would provide naming rights for a length of a contract that could be meaningful, for making it meaningful to the city? Or is there going to be a lot of turnover? Is it going to be short? Like, maybe we name a park, and then all of a sudden is that park now going to 10 years later, 5 years later, going to be named something else?
Right. Well, that's just it. We've seen that already. And, you know, when you go to another place that's also called Rogers, where's we heard Brent Totterman talk about this, the uniqueness of your place as well, kind of gets lost in there. Rogers bought Shaw in that example. So then the bike share, this is the bike share example. Sebastian wrote us, we have a couple of good emails here. Sebastian writes, will this kind of policy eventually lead to city naming? How about naming Vancouver Telecity? Oh boy, I do not approve of the heritage erasing policy. David writes, first, one wonders if anyone in the city of Vancouver is actually asking Musqueam, Squamish, and Tsleil-Waututh First Nations members what they might think about renaming of parks and public assets atop their unceded lands. As a fourth-generation settler, I find it offensive that the Vancouver government is considering renaming these public parks after corporate brands or sponsors without first consulting and discussing with MST First Nations. And second, the corporate brand creep into long-standing public places like parks or libraries or public schools and facilities is symptomatic of how all levels of government have really been afraid to actually tax big corporations and the wealthiest in our society. Implementing tangible corporate taxes on the biggest firms and wealth taxes would be a much better way of generating revenues. With such revenues in hand, city governments would not need to, quote, sell out our parks, assets, and rename them after the flavor of the day corporate sponsor. Okay, lots of thoughts there, David. Thank you very much.
Yeah, those are interesting. I mean, I guess what goes through my mind when you read emails from listeners like that is just how complicated this could become, and how Ken Sim's mayor's task force on finance is great idea to go out there and figure out what are some opportunities here, but the implementation is going to be very tricky. And this is city building. This is public governance. We're hearing all kinds of different attitudes and reactions to this type of thing. So I think the city needs to be very careful in how they proceed to actually do some of these things, and not be surprised if there is significant pushback. A lot of opinions about something as simple, let's say, as a small park being named after a corporation that's willing to put up some money for it. So you can see just how maybe fraught this is, or how delicate this could be.
And what consultation there might need to be. At the same time, the justification is that they would like to seek revenues without looking to increasing property taxes. We know that Vancouver City Council is looking at wanting to limit the next 5 years of property tax increases to less than 5.5%. So when you look at that justification for people in Vancouver, residents of Vancouver who have seen their property taxes increase, would that make this more amenable to them, do you think? Or?
I think if City Council thinks that it can put a cap on property taxes at 5.5%, there's going to have to be other streams of finances. Now, this came out of a meeting yesterday where staff was overviewing Vancouver's budget outlook from 2025 to 2029, saying 2024, we got a 7.5 increase. We probably need that for next year. And this is councillors pushing back, saying, wait, can we go lower, and can we cap lower? But cities are in tough spots right now, Michelle, as you know. Vancouver, for example, has all this infrastructure that needs replacing. They have pools that need replacing. They have other community assets that have not, Britannia, that have not been renewed and have been plans to be renewed.
Right.
And most notably because the funds have just not been there to do that. And capital spending on these projects costs lots of money, and governments are finding it to be very difficult to find ways to pay for them. So it's either got to come from property taxes, or as one of our listeners wrote about, a new tax regime that taxes in a different way to maybe tax wealthier entities at higher rates, or to come up with creative ways to find which this is one of those.
Okay.
Yeah.
A lot to discuss for sure. Our numbers again, 1-800-825-5950, 604-669-3733. You can hit pound 690 on your cell phone. And we have a caller from Vancouver, and Max is on the line. Hi, Max.
Hi, Michelle.
Thanks for calling in. What do you think of this idea?
Well, you asked about taste, and I don't think taste matters too much in this conversation. I think it's tasteless, but my question is more around how it would get done. And I looked at the civic something naming committee on the Vancouver website there, and it says parks and library assets are excluded from their ability to name. So I'm wondering how city staff is planning on changing park names, if that falls under the purview of this program, without, I don't know, dare I say, stepping on the toes of the park board.
Yeah, well, we've had that conversation, haven't we? Stepping on the toes of the park board. Max, thanks so much for the call. All right, so here's where jurisdiction comes in.
Yes. Well, yeah, he raises a really good point. But as we already know, the park board is under pressure from the city itself to be disbanded, and for the city to make a lot of these decisions. I don't know off the top of my head how that would work, but I mean, these are policies and legislations and bylaws and the way the city is constructed, and they could, of course, be changed. If the park board disappears, that's a whole other problem. But again, it's another there's more questions here than there are answers around this idea. It's a big idea. It's an opportunity to raise more finances. But again, it's the details of how do you actually do something like this? Who has the authority to rename a park? Does it fall under park board jurisdiction? I believe it does. But is the city able to, leverage its influence to come over the park board, or I mean, if the park board disappears, then it would be a city decision. So anyways, it's a good point.
It's a lot of questions as to how this would actually work. Thanks so much for the call, Max. Mike is up next in Vancouver. Hi, Mike.
Oh, hi. Thanks for taking my call.
Sure.
A couple of things occurred to me, but something came to my mind immediately when it comes to name placement and name recognition. Ken Sims and his party are getting a lot of name recognition, and this is what any politician wants. Just by discussing whether an idea is feasible or not, they're going, they're
Right.
getting us on the phone.
You're
They're
getting headlines and coverage. Yeah, sure.
That is a pragmatic name recognition. Going back to the other thing, let's say my house gets named Jimmy's. Do I get a lump payment sum, or do I get an annual payment for leaving that name Jimmy's? Because taxes roll around every year, regardless of how is the is it basically is there going to be is the name going to be a rental thing? That's another question. Plus, I've never heard a politician drop taxes. That just has never happened in my own memory. May talk about it, but as I said, they're getting name recognition themselves. But I can't see my property taxes going down. We don't have the time for me to give you the tracking of my property taxes for the last 30 years. Incredible. And
Mike,
they always say, well, we're going to cap it, or we're going to do this or that. I think it's just,
okay.
Politics by politicians for politicians, frankly. If I'm wrong, I like to be wrong, by the way.
Very skeptical, Mike. Thanks very much for the call as to whether it will actually in turn raise revenue and in turn save residents on those property tax increases. Ihor is joining us now from Squamish. Hi, Ihor. What did you want to say about corporate names on public spaces?
Okay. I'm just wondering how that whole process dovetails with amenity cost charges that are charged to developers above and beyond their development cost charges. Is there a dovetailing there? Should there be?
So these are the development cost charges that are charged to developers for. Yeah, go ahead.
No. Development cost charges are paid. That's so I can connect to sewer and water and all of those things. But then they have what's called an amenities charge.
Oh, okay.
Which says, and you have to donate a certain amount of money for the development of parks, et cetera. Mm-hmm. Is there a dovetail there that, I paid for that park, my name should go on it?
I see. If then a corporate sponsor gets to name that amenity, then who gets to benefit from that?
Yeah. I think if I can jump in, I think predominantly those amenity fees are negotiated at times, and they are set up as agreements between the developer and the city. So I would assume that they would be separate, but it raises a good point. But definitely amenity fees are a way by which the city can get added benefits and infrastructure for a city through a development, and they are negotiated, definitely.
And so, Ihor, it's interesting how we're hearing all these really intricate questions, right, about how is this going to work? And Ihor, is this something that, someone else touched on taste. You asked about taste. I don't have a lot to say about taste, but just generally, what's your reaction when you do see corporate names on a place?
It's just easier to remember sometimes.
That's practical. That's true.
It's Lord Stanley's Park. Yeah, I got that.
Easier to remember. Yeah, I take your point, Ihor. Thanks for the call from Squamish. You take care.
You're welcome. Bye-bye.
Hey, good point. Eric writes, what is the benefit to the corporation? Do they receive a tax write-off for a donation, thereby paying less toward healthcare and education, and instead get a free billboard on an entertainment asset. I prefer that companies pay taxes and have the municipality, province, or nation prioritize services that all Canadians can use. Linda writes, when I see corporate billboard advertising on public spaces, I believe that every level of government, federal, provincial, and municipal, has been derelict in making and enforcing laws that require huge corporations to pay a fair share of taxes, which would provide plenty of ongoing monies for public ventures. I feel these governments are selling out public spaces for the crumbs of billboard advertising while putting the tax burden on the public yet again when the profits of corporations grow yearly, sometimes quarterly. Thank you for all of your emails. bctoday@cbc.ca is where you can reach us. So what happens next here? I guess this is just one of the 17 recommendations on this paper to the report to the city and the mayor's budget task force. What happens next in this conversation?
Yeah, well, I think staff goes away now and tries to devise a way to do some of these things, which could take a significant amount of time. One thing, I'll just speak to some of the points made about this taxation. You've got to remember that cities have very few tools to raise money. They don't charge income tax. They charge property taxes. So having corporations pay more tax goes to other levels of governments, which then, yes, could trickle down, but as we've seen, it's not as the way that cities want it to be. So again, it gets us back to this point that cities are very limited in how they can raise money beyond property taxes, and so some councils are looking at more creative ways. This being one of them, but it's an ongoing problem with cities. It's just how do you tap into a proper taxation that will properly fund your city?
So are we conflating two? I know we've heard that criticism of the federal government when it comes to taxing of corporations as well. It's a talker, Chad. Thank you very much.
You bet. Thanks for having me.
Chad Pawson is CBC's municipal affairs reporter. BC Today@cbc.ca is our address.